the moment an infant is born, parents begin to plan and prepare to give their child the best life possible. For some, that comes easy, but for others, it is a challenge. For persons with disabilities, other challenges present themselves in an attempt to live a meaningful life as a productive member of society. Oftentimes, the needs of a specific individual are not always met through the decision-making process. Life-altering decisions can be made by caretakers, professionals, parents, and the person himself. It is important to consider positive and negative aspects of both, encouraging empowerment for the individual and taking responsibility for their care. Independence is valuable. For a person with disabilities who is transitioning to a post-school environment, independence should be the primary goal. This transition presents an ethical issue when it comes to respecting autonomy. Respecting autonomy guides us to ensure that we are always allowing individuals the right to independence. Ethical issues are related to respecting autonomy occur when one chooses to make decisions without input of their client or without valuing their rights to make an independent decision in their future plans. Do no harm is a core ethical principle of behavior analysis. When one vows to do no harm, they vow not to intentionally cause stress, pain, or anguish to their client. Oftentimes, this becomes an ethical dilemma unintentionally. For example, when promoting independence for a person with disabilities at transition age, harm may be done as a result of allowing the person to make their own decision. In other words, an ethical issue is present when the decisions are made by a participating party that negatively impact the effectiveness of the treatment or quality of life of the individual. There is a very important line between respecting autonomy and doing no harm.
Hi, my name is Andrea, and I will be the moderator of this debate. Each side will present their argument, followed by counter-arguments from the opposing side. We will begin with arguing for pro-client empowerment, presented by Elise.
Hi. Empowering clients should be the #1 priority for behavior analysts. There are several reasons as to why empowering clients is important. The first of these is that client choice is a constitutional right and should be respected at all times. This reason, above all, should be enough, as client rights are protected by the United States Constitution. There are also many core ethical principles that lend themselves to maximizing client rights, including respecting autonomy, according dignity, and treating others with care and compassion. Several studies show that when clients are given a choice in their treatments, better outcomes are observed. Lindheim et al. 2014 showed that when clients are given a choice between multiple effective treatments, there is a higher client satisfaction and improved outcomes. Giving a choice of treatments makes sense, as individuals will not always grasp the importance of treatments they are given. For example, a young individual may not grasp why a physical therapist is making them do specific exercises. The therapist knows and understands the reasoning behind all of their choices, but the client may not. If someone does not understand why they are being given a certain treatment, they are far less likely to participate effectively in this treatment. This is shown by Shinham and Carlo, 1995, who showed that people placed in residential settings do not always see the connection between treatments and their goals. If a therapist gives a choice in treatment that is in line with not only the goals of the therapist, but also the personal goals of the client, then both parties will work to their fullest to achieve the best outcome. Another aspect of client empowerment is the right to treatment and inclusion in the community. White versus Stickney guaranteed the right to treatment for clients with the end goal of allowing the client to enter back into society in a meaningful way. Even with this legal guarantee of client empowerment, some people are still against giving clients as much treatment as possible for various reasons. There are several studies that show how giving clients opportunities in communities improves outcomes and client satisfaction. Valenti et al. 2010 shows how community-based treatment with parent co-directed early intervention shows positive outcomes and family satisfaction. Many families of children with disabilities have difficulties taking their child into public settings. Often, the best place to work on these skills is in the community itself. Another reason to include the clients in the community is that the clients themselves want to be included. Like any typical person, individuals in residential settings do not want to be holed away in the rooms all of the time. They desire meaningful social interaction as much as any other person and should be allowed to participate in society as such. There are other instances of treatment plans being created around the needs of the client that include social interaction. A family foster care model from Bilson 2016 has shown high rates of client and family satisfaction. Brown and Ringma 1989 showed that experienced staff, sympathetic organization, and motivated consumers can work together to create an effective client-based treatment. All in all, it is entirely possible to create highly effective treatment plans for clients by giving them meaningful choices in treatment and allowing them maximum social interaction as well. There really is no reason for an individual to not be given these opportunities, especially considering they are legally guaranteed. Here is a short video that demonstrates the benefits that empowering clients can have. Can you see my screen?
No.
Okay, hold on. I will now present the arguments against pro-empowerment. Empowering clients to take total ownership of their treatment plans, overall well-being, and improved quality of life is not practical, ethical, or in their best interest. Empowerment of clients is currently a popular movement. It holds appeal as it respects their autonomy and shows respect and dignity. Individuals placed in residential settings do not always see the connection between treatment and their goals. However, individuals who remain in their own home do not always see treatment at all. And when they do, it is not always followed. Leaving the individual in their own home or community leaves them in a setting where their treatment depends on the commitment, training, and energy levels of family and community members. This is much less reliable than the commitment, training, and energy levels of trained and paid staff members in group homes or treatment centers. Community-based treatment is not always practical. Individuals with disabilities are often the last hired and the first fired in the U.S. economy. Individuals with disabilities are in need of advocacy in the workplace and do not always have access to this when left in their own homes or communities. According to Bilson 2016, family foster care may show high rates of client and family satisfaction. However, that may not be the only measure necessary to determine the highest quality of life for an individual with a disability. According to Ham and Miranda, 2006, there are not yet enough resources and vocational services to empower and build independence for persons with ASD. According to Martin, 2006, persons with disabilities express their desire for inclusion in community and their daily life. However, according to Ham and Miranda, 2006, clients have negative reputations in their communities due to problem behaviors in which they regularly engage. Successful engagement in community is unachievable if some behaviors are not regulated and safety of self and others is not guaranteed. Empowerment of clients respects the autonomy of individuals, accords dignity, and treats them with care and compassion. However, these goals cannot be achieved until the individuals with disabilities develop skills to engage in socially appropriate and safe behaviors.
Next, John will present the arguments for pro-client care.
While giving clients the greatest amount of choice possible is definitely important, the primary responsibility of a behavior analyst is to provide quality care to their clients. Time and time again, clients show that they cannot make responsible decisions for themselves. According to Smith and Bell, clients who are given free choice regarding food will often choose the unhealthy option over the healthy option. This is just one example of why clients should be limited in the amount of choice they're given in treatment. The first and most important core ethical principle is to do no harm. A behavior analyst should never make a decision that will harm the client. In allowing the clients the ability to make harmful choices for themselves, such as only eating unhealthy foods, never engaging in physical or social activities, or even choosing a treatment that has no evidence showing its effectiveness, it could be argued that a behavior analyst is partially to blame for any harm caused by these decisions due to their complacency. Another reason to focus on client care over empowerment in treatment is that clients often choose ineffective treatments with little to no support showing their efficacy. According to Bailey and Birch, behavior analysts are trusted with the responsibility to choose the most beneficial treatment for their clients. Also, the BACB Code of Ethics, Code 2.09a, states behavior analysts always have the obligation to advocate for and educate the client about scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to the clients and society. Despite this, PRAE 2006 shows that clients often opt to use treatments with little to no empirical evidence showing their effectiveness. Examples of these are gluten-free diets, hyperbaric oxygen, and CBD oils. When they come to a behavior analyst for treatment, they should accept that the therapist is a trained professional and their recommendations are backed up by a large knowledge base. As behavior analysts, we have an ethical responsibility to pursue excellence. This means a qualified behavior analyst should have the ability to cite sources for their decisions in the treatment-making process. One final reason that client care should be prioritized over client empowerment is that individuals with disabilities often have very aggressive tendencies. Murphy 2010 states that individuals with ASD can have severe violent behaviors that can pose a serious risk of harm to themselves or other members of society. In these cases, core ethical principles such as do no harm and benefiting others should be at the forefront of the decision-making process of behavior analysts. A client cannot be allowed to cause injury to themselves or others. In accepting your services, parents and guardians shift responsibility of that individual's safety to you. In addition, you have a responsibility to society to manage the challenging behavior in the safest manner possible. If a client refuses to allow you to manage the situation, then they present a harm to themselves and others. This may involve using restraints on an individual in crisis. While the BACB Compliance Code 4.09 states that we must use least restrictive procedures, in these cases where there may be extreme danger to themselves or others, the least restrictive procedure is to keep everyone safe, may be a procedure that limits freedom of choice of the individual, such as a restraint.
Now, Haley will present the arguments against ProCare.
According to the Autism Resource Center, the definition of a guardian or caregiver is a person or agency that is appointed by the court to make personal decisions for an individual who is not capable of making some or any decisions independently. But as a society, how do we determine whether or not an individual is capable of making his or her own decisions? For some persons with disabilities, decisions are solely made by their caregivers in hopes that it is in the best interest of the client. This leads me to question how the best interest of the client be met if the client has no say in decisions that impact their life. As mentioned earlier, client choice is a constitutional right. By giving caregivers sole responsibility over their loved ones, we violate not only the rights of the client, but many ethical issues. According to Bannerman, 1990, the lack of empowerment disregards the legislation and right to client choice. It also affects client choice-making skills and affects their ability of living independently in a community. Research indicates that when clients have a say in their treatment plan, there is a greater likelihood of success. Think about it. Many people spend a significant amount of time in college or university learning skills necessary to become a professional in their career field of choice. Their right to a choice gives them the ability to pursue any career they wish, which in turn empowers them to explore their passion and become an expert in that field. If the ability to choose was taken away, it is likely that the student would not strive for the same level of success as they would in a field of their choice. This goes for persons with disabilities as well. Why would one be as eager to be successful as something that they don't take any interest in? When caregivers take sole responsibility of the choice-making process, they are taking away a constitutional right of the client and altering the success rates of the treatment. By eliminating a client's right to choose, the ethical standard of respect autonomy is violated. Respect autonomy is an ethical code that was set to ensure a client to their right of independence and personal growth. Ethical issues in respect autonomy occur when one chooses to make decisions without input of their client or without valuing their right to make a decision in their future plans. Professionals are required to hold ethical codes to the highest standards. Caregivers should be required to do the same. Consider this. How can they expect someone to hold a job and be a functioning member of society if every decision about their future was made by someone else? In order for a person with a disability to take responsibility for their actions in their life, they must have a say in any decision that involves them. Decisions that lead to empowerment can be simple. For example, just giving a client a choice between 2 appropriate job placements or even 2 appropriate reinforcement activities. Though at times it may seem like taking sole responsibility of client care is in the best interest of the individual, allowing the client to have some say in their treatment plan is likely to positively affect the success of the treatment and is likely to empower the client to strive for independence to the maximum extent possible.
Like many things in life, a more middle-of-the-road approach is frequently the best. Behavior analysts must find a balance between client empowerment and client care. The vast majority of our clients with autism spectrum disorders are not going to be capable of making every decision in their life. However, with the right education and training, there is no reason for them not to be able to take control of many aspects of their life. Bannerman, Sheldon, Sherman, and Harchick, 1990, list several steps that can be taken to increase client choice by teaching appropriate skills. First, we must emphasize teaching independent living skills and other functional behaviors that are preferred by the client. If we need to work on food preparation skills, what difference does it make if we teach our client to stick a bag of veggies in the microwave to be steamed rather than chopping ingredients for making a fresh salad? Either way, they are learning a valuable skill towards the goal of feeding themselves a healthy meal. Secondly, our clients should have input in decisions about what skills they will learn and how they will be taught. If they would prefer to learn skills for a job where they prepare mailings as opposed to learning food preparation skills for a kitchen job, that should be their prerogative. They also need to be taught how to choose. This, however, can be a big hurdle because there are not a lot of programs for teaching how to make choices. Some have suggested something as simple as teaching our clients concepts like choose now or later, or I want and I do not want. Everything doesn't have to be a major decision, but we all want some autonomy in our lives. Whether it's a toddler who wants to wear the pink striped shirt and the red polka dotted pants with the bright green rain boots, or a client with autism who wants to eat all of their chicken nuggets before they touch their green beans. Lastly, clients should be given opportunities to make choices in their residential and work settings within and between scheduled activities. In a residential setting, staff members need to be aware of making opportunities for choice. In the free time after dinner, before bed, does the client want to watch TV or read a book or sit on the back porch and watch the sunset? It is completely implausible to think total client empowerment or total client care is the right way to go. Those two ideas are just too extreme. We need to aim for a middle ground where clients have the right to voice their opinion regarding treatment options as well as selecting leisure activities. There will always be some instances in which decisions must be made for a client for their own protection or for the protection of those around them. But whenever possible, we need to let our clients make their own choices. In conclusion, client choice is a constitutional right. However, severe behaviors can be dangerous to our clients or others, so there are times when coercion may be necessary to get our clients to stick to their treatments. There are numerous examples in the scientific literature where client choice improves the outcome of that client's treatment, yet clients do not always choose beneficial treatments. There are several core ethical principles that apply to both client empowerment as well as to client care. Core ethical principles for pro-empowerment include respecting autonomy, being just, and according dignity. And the core ethical principles for pro-care include do no harm, being faithful, and treating others with care and compassion. BCBAs need to strike a balance between care and empowerment. Clients need to be given as much choice as possible within limits. Empowerment does increase the client buy-in to the treatment process. So, while they may not love every aspect of their plan, any decision we can let them make is going to help in getting them to go along with the plan as a whole. Empowerment can also lead to increased generalization of skills. Who among us doesn't want to take a new skill and use it again and again? The child who has just learned how to swim wants to show off for their brother and sister still learning how to swim, and they want to go show Gigi and Pop Pop at their house, and they want to show off their new skills to their friends at the beach too. Aggressive or apathetic clients may require more than a suggestion or recommendation regarding their treatment. BCBAs must always be aware of the conflict between client care and client empowerment, as well as the applicable compliance codes.
So now we are going to answer a couple of questions that we were given. So I'll go first. One question is, give an example of a time in practice that you or someone you saw had to choose between empowerment over care or care over empowerment, what happened, and would you do anything different today? I personally where I work, we often love to put kids into restraints when they're becoming very aggressive and start to pose a risk to the staff that they're working with or themselves. So I do have to make the call to, restrict clients every now and then. So I think that is very necessary and a very important part of what I do. And I wouldn't really change anything about how we do it, because we always make sure that we never do harm. We always monitor the client as they're in their restraint to make sure that they're not in any like severe distress or anything like that. On the flip side of it, we also make sure that clients have as much choice as possible. So we always do like mini preference assessments to make sure that the kids are working for something that they want to actually earn, instead of just choosing, okay, we're going to go play on the swing this time. And that's not always effective if a kid wants to have a snack because they're hungry, or if they want to watch a video because they really love watching like trains or something like that. So yeah, that is a decision that we have to make a lot at my job.
I can go next. Another question we have is, when does client care become more important than client choice? I would say that client care becomes more important than client choice, most importantly when the client is harming themselves in a physical way, if they are engaging in head-directed self-injurious behavior, or self-injurious behavior in any other part of their body that causes tissue damage. I would say that it's the responsibility of the behavior analyst to intervene and provide care or restrictions, even if the client does not wish for that to be so. Also, when the client is posing a risk of harm to other people, I would also say then it is necessary for a behavior analyst to step in and intervene. Another time that it might be important for client care to supersede client choice is when a client insists on engaging in treatments that are not evidence-based or can cause harm to the client. It might be important to at least inform the client or inform the parent of the lack of research, the lack of evidence on those treatments, or the potential harm that could come to them through that, and provide other options that we know are proven successful, especially through ABA and behavior intervention.
The last question that we were given was, what are the consequences of giving in to client demands when they do not fall in line with your treatment plan? Elise and I were kind of going back and forth and discussing this one prior to the start of this debate. And we just kind of came up with a list of a few things that we felt happened when you gave in to client demands. The first is when you give in to client demands that don't go along with the treatment plan, there's a great possibility of new behaviors. For example, the first thing that comes to mind is escape. When you're giving into those demands, they learn, oh, I do this, and the consequence is this, which then kind of leads to a loss of instructional control. You also are not, well, when you give in to client demands, you're violating client rights, such as do no harm. I mean, there are often times where clients may request something that could cause harm to themselves or to others, and if we give in to those demands, there's a potential to do harm to those clients. Also, the client has a right to an effective treatment, and if you're not following the plan that is set in place, the likelihood of an effective treatment decreases. So given that, there's some pretty significant points that could happen if you give into client demands that are not part of the treatment plan.
Thanks for watching our debate. Done.
Okay. So for me, when you played your video, it didn't move at all.
No,